Hello, welcome everyone to this important conversation that we were going to be having today on equitable distribution of vaccines. My name is Peggy Clark, and I'm Executive Director of Aspen Global Innovators Group and Vice President at the Aspen Institute. And thank you so much for joining us. Today, the Global Inclusive Growth Partnership, which is a partnership between the Aspen Institute and the Mastercard Center for Inclusive Growth, is presenting an important conversation on ensuring the equitable and effective global distribution of vaccines. And this conversation is part of a series, Global Inclusive Recovery and Rebuilding, which was developed with the Aspen Institute and Mastercard Center. And we're joining with Aspen Global Innovators Group and this effort to present this presentation today. We're very honored that Elizabeth Cohen of CNN is leading this conversation. And as a reminder, you've submitted questions when you registered, and we are happy to get to those questions as part of this conversation. So thank you all, and welcome, Elizabeth.
Peggy, thank you so much. And I'm so glad to be here with all of these wonderful panelists that we're going to have with us. Nearly 10 months into this outbreak, COVID-19 is exposing deep inequities in healthcare systems worldwide. And there are hopes that a vaccine will really change things, because right now this virus has killed more than 1 million people worldwide. It's infected more than 44 million people. Millions have been left without work, and economies have been left, many of them in terrible shape. So how do we ensure that vaccine development and distribution process is unhindered by domestic and international geopolitics? So I'd like to introduce my guests. Kathleen Sebelius is one of America's foremost experts on national and global health issues, human services, and executive leadership. As CEO of Sebelius Resources, she provides strategic advice to companies, investors, and nonprofit organizations. Mike Froman serves as chairman for Mastercard, and in that role, he's responsible for growing strategic partnerships, scaling new business opportunities, advancing the company's efforts to partner with governments and other institutions to address major societal and economic issues. We also have with us Anita Zaidi. She is the director of the Vaccine Development, Surveillance, and Enteric and Diarrheal Diseases Program at the Bill and Melinda Gates Foundation. Her team's work is focused on vaccine development for people in some of the poorest parts of the world. And finally, we have with us Marie-Ange Sarakayo. She's the Managing Director, Resource Mobilization, Private Sector Partnerships, and Innovative Finance at Gavi, the Global Alliance for Vaccines and Immunizations. Since joining Gavi in 2011, her leadership has been instrumental in raising critical resources to provide equal access to vaccines for all. So thank you. We are all so honored and lucky to have you with us today. So thank you so much. Let's start off broadly, and whoever wants to jump in, please do. Are you concerned that the vaccine development process has been or will be hindered by politics, either domestically or internationally? And if so, what can we do to tamp that down?
Start this. Oh, maybe I can start this
Sure.
From the United States, because first of all, it's great to see you, Elizabeth, and thank you to the Aspen Institute for organizing this conversation. I'm delighted to have a chance to be with Marie-Ange and Anita and Mike, my colleague from the prior administration. We worked together on lots of issues. But at least from the United States perspective, I think there's no doubt that we're in the middle of a political debate. And unfortunately, that has huge impacts on vaccine distribution here in the US, as well as in the world. The United States has withdrawn from our leadership effort with equitable distribution worldwide. We're threatening with this administration to pull out of the WHO, which is a critical platform for transparency and distribution. We have not participated in 2 of the large funding conferences that have occurred with our neighbors in Europe and others to look at investing in equitable distribution and manufacturing. And I would say also, even with CEPI, which is a post-2017 organization focused on, a coalition focused on epidemic preparedness, Congress has not really invested. We've put a total of $20 million into that entity. But CEPI currently is proceeding with investment in 9 vaccine candidates. The US, in our US-centric warp speed, is only investing in 6 of those 9. So we have the possibility in the United States to be at the back of the line if one of the other 3 is actually the first to show effectiveness and safety. So not only are we not providing leadership in the world, we're not participating in this world effort, we're threatening to withdraw resources in the future, which could really hamper the world effort, but we're putting, I would say, our citizens in a deeply dangerous situation if we don't rejoin the world collaborative very soon. And it's all about politics, not about science.
Okay, thank you, Kathleen. Anyone else want to jump in on this question?
Elizabeth, if I could just add to that. First, I broaden out the question even further. We're all here to talk about vaccines, of course, but the same could be said about therapeutics and diagnostics as well. And it's one reason why we joined with Gates and Wellcome to create this therapeutics accelerator, precisely to make sure that there was equitable distribution of testing and of treatments, even as we work on the vaccine. It's very important to have that. And it's not just the right thing to do. It's if you don't have that equitable access, if you see nationalism or protectionism introduce themselves into the supply chains and introduce themselves into distribution, you're going to end up driving up the cost of the drugs at the end of the day, and you're going to diminish the effectiveness. It's in our interest that people all over the world are treated appropriately, tested appropriately, and vaccinated appropriately. We've got to stomp out COVID wherever it is. Otherwise, we're just going to see waves of it coming back onto our shores over and over again. I think there are actually some useful lessons. I hate to be myopic as a former trade person, but I think there are actually useful lessons from the trade and investment world. And people like Chad Bone and Thomas Bollocky have written about applying certain principles from the trade world to vaccine nationalism, reducing export constraints. You know, many countries, not just the US, threaten to or put on restrictions on the export of PPE, on ventilators, and threaten to do some of the same things with some of the supply chain that goes into drugs. Import barriers that could be reduced, both tariff and non-tariff barriers, expanding the supply chain so that we're not overly dependent on just one country or one source for some of the inputs, the compounds, the adjuvants, et cetera, would be a good step towards ensuring that there is the free flow of treatments over time. And ultimately, of course, that requires coordination globally and frankly, US leadership, and having the US be at the table, as Kathleen said, and demonstrating leadership in this effort as very difficult questions about how to distribute what will, at least at the beginning, be scarce resources is going to be critically important.
I can add from the Gates Foundation's point of view that it's very, very clear now that without a global approach that makes sure that the entire world is protected by using safe and effective vaccines, we are not going to end this pandemic. So anything that we can do to bring the world together, including the US taking its rightful place in the global fraternity, is just critical for everybody to be protected everywhere. We have been through much effort of scientists, policymakers, other people who understand how the pandemic has evolved and needs to be controlled. The global organizations did in many cases come together. So this is how we got to the Act A, the Access to COVID Tools Accelerator, of which COVAX is a really important pillar. COVAX is a consortium of existing entities that work on vaccines. So Gavi, Global Alliance, which procures and delivers vaccines to developing countries. CEPI, what Kathleen mentioned, the Coalition for Epidemic Preparedness and Innovation, which is responsible for developing epidemic products, especially vaccines. and WHO. Those three organizations have come together and in this coalition called COVAX, which now almost the entire world is part of, with the exception of the US and Russia. We hope that the US joins COVAX. That would be, and then everybody can work together. From the scientific point of view, it's just been heartening to see how people from the world have come together to advance COVID vaccines in a safe way, to show that they are effective and they can control the pandemic. So a lot of collaboration is happening, but much more is needed.
So indeed, Elizabeth, to your point, I think indeed there's concern because obviously there's never been such a pandemic of that size, and of course the work is daunting. But as the colleagues before just said, we have also seen actually a wake-up call in a sense and a movement for multilateralism and for coming together. And indeed, Gavi, together with CEPI and WHO, are leading COVAX, and particularly the COVAX facility, which today regroups 184 countries. And really here, the idea is to, given the magnitude of the work, is to pool resources, pool risk, and really adopt this portfolio approach of investing at the same time in 10, 15 vaccines that can be accelerated together. And because they're in a portfolio, in a sense, you mitigate the risk with a view that in 12 months or 18 months, by the end of 2021, a certain number of doses can be procured, and that provide a minimum buffer to actually, quote unquote, guarantee access for 20% of the world population, so that we can at least, vaccinate the high-risk people, the frontline workers, and start from there. Because indeed, one of the difficulty is being first in this supply constraint environment, where it's the first time that you need a vaccine for 7 billion people, and it's very important, the cooperation that Mike was talking about, because it's, in a sense, making sure that everybody access at the same time. So that, given the globalization that we have seen, everyone can be protected at the same time. Otherwise, it just won't work,
A few of you mentioned COVAX, and an audience member had a question about that. So let's get to that audience member's question. So COVAX, just as background, is being led by Gavi and CEPI, which is the Coalition for Epidemic Preparedness Innovations. And the aim is to accelerate the development and manufacture of COVID-19 vaccines and to guarantee fair and equitable access to every country worldwide. So this audience member notes that as many of you have, that the US has not joined COVAX. And the audience member asks, how can the US participate in global developments around COVID vaccines? And I would add, and Kathleen, I think you touched on this, what is this a problem that the US has not joined this, and what should be done about this? Marie-Ange, since we've got you up here now and you're with one of the leaders of COVAX, can you address this?
Yeah, so I think, there are a lot of ways in which the US can contribute. And I think, through the Gavi board, where the US is very active, obviously, there's a lot of conversation indeed because, you don't deliver vaccine alone. So there's a lot of work to be done in delivery. So there are a lot of areas where the US is keen to come in and participate. And also in the support to low and middle income countries, where the US has been very supportive of Gavi. We have set up actually this special initiative, this innovative finance instrument called the Advanced Market Commitment for Low and Middle Income Country. And, that will be targeted at making sure that low and middle income countries have access to the vaccine at the same time. And there's a keen interest there from the US, but also on the delivery. At the same time, there are a lot of initiatives that are being discussed, with our partner CEPI and the initiative Warp Speed in the US. So there's various collaboration happening that may not be inside the act, but where, there's possibility of collaboration And the positive sign is that there's really a great dialogue in that space, in continuing the support, because the US is also a key supporter of Gavi, and continue through that angle to support the initiative.
Elizabeth, if I might, I think Marie-Ange is very accurate in that Congress now is very committed to Gavi. Congress understands this global relationship. They are committed to making sure that Gavi is funded and that the US funds continue. So regardless of what the administration has intended, I think Congress is sort of a protector. CEPI is a newer entity that was focused on, research and development. But I think that the threat that the US would not only not participate in CEPI, but withdraw funding from the WHO is really dangerous in terms of the world's capacity. Our resources are needed. And I would say, our leadership is needed to mobilize an effort of developed countries to look at outside of the borders and say, we not only need to vaccinate our own populations, but we need a global view, because diseases know no borders. If somebody is ill in Africa or Asia, that still is a threat potentially to the United States. And it's also the right and moral thing to do. So I think with, we're on the eve of an election. There are two very different views of global participation in health that are held by the two presidential candidates. And I don't think there's any question that we would rejoin various global pacts and put resources in different places if there is a change in administration. But this is a relatively new and current view that is, I think, potentially worrisome, not just for the safety and security of the American public, but for the safety and security of the world. Because without the US resources and kind of moral call to gather together, the EU has done 2 spring meetings. The United States didn't participate. They've done a giving conference. The US did not participate. So while Gavi luckily is protected by Congress, that still is very dangerous when you see a global pandemic raging.
Right. Thank you, Kathleen. Mike or Anita, do you want to chime in on this issue of the US not belonging to COVAX?
I would just note everything that Kathleen and Marie-Ange has said is absolutely right. What's been interesting is that even in the absence of US federal government involvement, you've had a lot of participation of the private sector, obviously the pharmaceutical companies and others, biotech companies, other companies like our own that have been supporting these efforts. Lots of activity by philanthropies, chief among them the Gates Foundation, but also a number of others in the US and elsewhere to try and at least keep the progress going. The danger is, just think how outraged the US would be if the vaccine, if the vaccine that emerged, as Anita said, as being the most effective, was produced somewhere else and we did not have access to it because we did not participate and because we did not support the global effort. We would be outraged. And so I think there is, well, a lot of the research is being done in the US. There's certainly research going on elsewhere, and we want to make sure that the US is part of those efforts and supportive of those efforts, as well as leading that very difficult conversation about where do the first 100 million or billion or 2 billion doses go? Is it to healthcare workers and frontline workers? Is it to the elderly and the vulnerable? Is it to children so they can get back to school? Is it in producer countries or non-producer countries, rich and poor countries? There's going to have to be a number of hard decisions made, even as we're building up to the 7 billion doses or the 14 billion doses, depending on the nature of the vaccine, how many doses are required. And there's going to need to be US involvement and leadership in that effort, or it's going to be quite chaotic.
Okay, thank you for that, Mike. Anita, you mentioned COVAX a bit, I think, but did you have anything you wanted to add?
I would just add that I'm really optimistic that the US will play a huge role from the Gavi side. And so because it's one thing to make the vaccines, but vaccines don't work unless they get to people. And on that sort of get to people, there is a huge opportunity for the US to play a really, really big role, as they have historically played in Gavi, through which so many children around the world, I mean, the US shows so much generosity to the rest of the world by immunizing children everywhere. And there are many, many other infectious diseases that are very dangerous, such as measles. And Gavi plays a huge role in getting measles vaccines to every child around the world. And so I have my fingers crossed that we will see the US play a lead role from on the delivery side, even if we've missed this opportunity on the development side. Although we haven't totally missed the opportunity there, because the US research may find vaccine that works, or as Mike was just saying, it could be from the research that's done outside of the US. So there's much more clarity on how, if some research is done outside of the US, how would that vaccine get to people everywhere? And there's not so much clarity right now from the US, but one can hope that the private sector takes on that role on the R&D side. So if it's a multinational company that has development facilities all around the world, that vaccine can be provided to people around the world. I'd also make one other point, which is there's a very interesting analysis that was done by Northeastern, which shows that if you have, let's say in the next year, we have 2 billion doses of vaccines. If all of those vaccines are just used by high income countries, that will result potentially in twice the number of deaths than if we figure out how to distribute those vaccines equitably around the world to people most at risk. And so it's the delivery side of this, and how, and Mike was referring to this a little bit, how we make the decisions around who gets vaccinated first when supply is going to be limited, which is going to be the situation in 2021. It's really important for the world to come together and figure out how we do that in an equitable way, which makes the most sense in terms of saving lives and getting the world back on its feet again.
You know, I want to touch on something that Anita said. I think when this vaccine effort began, really back in January, there was this sort of assumption that people would want to get it. And in fact, the concern was, how do we get it to everyone who wants it? But in the months that have passed in the US as well as in other countries, polls have shown that many people don't want to get this vaccine because they fear that it won't be safe. I mean, in the US, there's polls showing that a third or even a half of Americans say that they don't want to get it. And I know there's also a significant chunk of people in other countries who don't want to get it. Can any of you comment on that? I mean, a vaccine is only good if people actually roll up their sleeves and take it. Anything we can do to increase the trust in this vaccine?
I can go first, and I'm sure my fellow panelists will add a lot more color. So this is a big worry, right? In which there is an infodemic of misinformation on vaccines right now, not just COVID vaccines, but all vaccines. And all of us will have to work really hard to build confidence, build trust in vaccines, which then involves working with communities, understanding communities' concerns and addressing those concerns. And so I really like the phrase building vaccine confidence in communities, that this vaccine is safe, that this vaccine will work, it will protect people, and that all of the science that needed to be done to show that these vaccines are going to be safe and effective has been done, that corners have not been cut. Which is why how we communicate and what people say is really, really key. But there is going to be no shortcut to working with communities and trusted leaders to build confidence in the vaccine again.
Okay, anyone else?
Well,
Yes,
I think
if I follow up on Anita, I think one of the ways to build trust is to start preparing very well now. And as we are saying, there's producing the vaccine, but there's the whole process of delivering the vaccine. And I think that's where all of us, and in particular the private sector, given its expertise, especially in tracing, in data and measurement, but also, of course, the communication platforms to actually bring the right information about, the information that will be coming up. So it first starts really, and I think that's part also of multilateralism, is by really bringing, of course, international experts that can bring the best of science and a rigorous approach, but then also having very strong monitoring and measurement. But then it's also about, how we measure it in country. And I think that's where the private sector can help a lot. Gavi and Mastercard, we started much before COVID, this partnership of being able to trace in some of the low-income country and the children's vaccination. And now, this is being turned into actually being able to get first information about monitoring COVID-19 situation, get a better sense of what's needed. And I'm sure once the vaccine become available, this is the type of platform, the wellness pass that we can use in a lot of countries to help really provide the information, but also get a feedback loop. So I think that's where, in a sense, there's a much bigger effort and a call to, everyone, and it's really in the reach of every, in the sense of having to participate in this type of efforts, because the delivery is actually, I think that will be the most important, preparing, communicating, using community-based workers, but also science and technology.
I think in some ways, in the US at least, we will be better off regardless of the outcome once we cross the threshold of the election. And it is clear that vaccine approval is not tied to the campaign. Unfortunately, that has been asserted over and over and over again, which I think has raised the level of skepticism of some of the American public about our safety guidelines being shortcut. Is this a sort of political trick? Is this an October surprise? So in some ways, just crossing that threshold of November 3rd and letting the scientific process fully be on the front lines of vaccine approval will be helpful to, I think, a number of Americans. I do think that the whole communication strategy around vaccines itself not only needs enormous help in the US, but globally. Unfortunately, we've seen, and my colleagues here are much better versed in this than I am, but, vaccine workers killed in parts of the world where they're not trusted, where they're seen as trying to undercut either leadership in a country or actually bring illness to people rather than bringing health and safety. We've seen health and safety workers being chased out. We see it here in the US, I think, in people refusing or resisting any kind of contact tracing. When they're called and asked who you had contact with, they refuse to answer. So there's a growing skepticism about, is this going to be helpful? Is this going to be beneficial? And the faster, hopefully, we can get not only a communication strategy in the US, but worldwide that's on the same page, that reinforces the science, that gets the politicians out of the way and lets the scientists lead, and then reinforces the notion that as long as the virus is swirling somewhere, it's swirling everywhere. But I think in some ways, getting past next week in the US may hopefully diminish the political concerns that have been raised about whether or not the vaccine is too closely tied to the presidential election and whether corners will be cut.
Okay, thanks for that. Mike, do you want to talk about vaccine confidence a bit?
Well, the only thing I would add is that in this area, maybe even greater than many other areas, it's all about trust. And we see surveys of people who have looked at what institutions in society have performed well on the trust measurements versus others when it comes to COVID. Interestingly, the private sector has done really quite well. People feel like their employers have been sharing a lot of information, have helped them, have supported them. Local governments have fared quite well. At least in the US, the national government has fared less well in terms of how it's dealt with COVID and the trust that's built. But to go to Marianne's point, I think looking at how do you deliver with trust and using the tools of a trusted network to be able to reach out, help health workers, collect in a privacy-focused way the data that helps governments understand where in the country the program is working and where it's not working, being able to remind a parent or an individual when it's time to come in for the second shot or the booster shot. There are lots of tools out there that can give people confidence that if they participate in this program, they're gonna be protected, and that's going to be absolutely critical going forward.
Okay, thank you all for those insights. Let's talk about distribution for a minute now. In the U.S., what are some of the inherent social and racial inequities that might be present in vaccine distribution, and what can we do to counteract those inequities?
Do you want me to start?
Sure, go ahead, Kathleen.
Well, I think COVID, unfortunately, has unpacked or shined a bright light on lots of racial inequities in this country, not the least of which is that the death toll on Black and Brown communities is astounding. What's happening in Native American communities is even more troubling. So there are underlying health concerns, there's density concerns, there's lack of access to health care. A lot of what we call, the social disparities are really front and center in COVID. And I think, if anything, when we get to a national plan, which we still don't have, and in some areas of the country, local leaders are focusing, I think of Lori Lightfoot in Chicago, the current mayor, who has put testing hotspots and additional health personnel in major underserved areas in the city of Chicago. And that seems to have done a pretty effective job in lowering the virus transmission and in making sure that people who were positive were isolated and had safe and secure places to live and isolate. In other parts of the country, that hasn't happened at all. So the death toll is extremely high. And I think it just highlights that whatever our COVID recovery plan is in the US has to have real focused attention on healthcare access, testing, tracing, safe places to quarantine and isolate, and then vaccination for people who are in densely populated areas, on frontline jobs, who often don't have the luxury of working from home and have the luxury of being in a Zoom meeting in a private space. People who have to go to work need to be on the front lines of the vaccine, along with critical healthcare workers. So right now, we don't have a national plan for vaccination. Each state is submitting their own plans. There's no transparency around those plans. And again, hopefully we will get back to the point of not only having the CDC identify priority vaccination groups, but making sure that the delivery system is well equipped to get into areas with typically lack access to healthcare, lack access to providers, and identify folks who need to be on those front lines. That's a big order. We haven't done it very well so far in the virus in the 8 months that has raged, but we have a playbook for how I think to do it in the future.
Anyone else have any thoughts on racial and social inequities that would affect vaccine distribution? Actually, anywhere, not just in the U.S.
Yeah, so this is an issue, the sort of ability of this virus to expose the inequities in society, whether racial, income, where you live. It's just been age, nursing homes. It's just been it's been unbelievable to see how the virus has affected society and shown a light on all of the inequities that exist in countries around the world. So vaccine, because of the particular legacy in the US around race, it's a particularly difficult issue of access and information and trust in the system, in the health system. And so extra effort is going to be needed in the US to reach out to communities, marginalized communities, to make sure that they understand the importance of vaccines and have access to those vaccines and don't have to worry about access to testing, access to care. From the foundation, we have made grants to historically Black university colleges to increase access to testing for urban populations of color, and also access to information about vaccines. Similar efforts will have to be made in other populations, which is why it's really important for us to come together as globally around the world to decide how to distribute the vaccine in 2021, and who are the first groups that should get the vaccine based on criteria about what we understand about risk, right? And because that is the most rational approach to protecting people and saving lives.
Before I move on to the next question, anyone else want to talk about racial and social inequities how they relate to vaccine distribution?
The only thing I would add is that you're looking back over the last 8 months, this has really been the unfortunate perfect storm of a health disparity, economic disparity, and then racial disparity in light of the George Floyd murder. And the combination has really, as Kathleen said, shined a very bright light on the structural issues in the country that create these disparities. And so when there's a vaccine available, it's going to be doubly important that the governments, philanthropies, private sector all come together in a way that recognize that and make sure that this is not yet another fourth disparity in terms of how treatment is dispensed, how vaccines are dispensed to this community.
Anita mentioned priority groups and, sort of the flip side of what we were talking about before, which is that we might have a lot of people who don't want a vaccine. We also might have people who are getting in line for a vaccine who are not a part of whatever priority group is being prioritized at that moment. Do you folks perceive any issues with that, with verifying that people belong to the priority group that's first in line at the moment? Is that going to get messy, or do you think that will go smoothly? For example, if it's just healthcare workers, or if it's just people with underlying conditions, is that going to get messy verifying who's who?
I think Kathleen will be able to answer this in more detail, but I'll just quickly say that this is why you can't have a state-by-state approach, right? This is why you need centralized thinking on this, and why CDC should be playing a lead role in figuring out how what the strategy should be to vaccinate in the US. So everybody is doing the same thing, because if you have different states competing, which we saw early you're going to have a very messy situation.
Well, I think that's true. The state-by-state approach is, to put a fine point on it, pretty nuts as far as I'm concerned, because it leaves a very high possibility of very inequitable distribution and kind of chaotic transportation to get to sites where you vaccinate. The US, at least, and I don't know how the rest of the world will deal with this. We had an issue with the H1N1 vaccine where part of the group identified at the front of the line were healthcare workers, and yet there was an objection from many of the healthcare workers to be vaccinated. I think this is a situation which ramps up the contagious possibilities to a higher level, and whether or not the US will actually look at some mandatory vaccinations, I don't know. That conversation is very complicated, but may be essential in this case. It's very difficult to think about healthcare workers dealing with COVID patients and not being vaccinated themselves, so they continue the spread, things like that, nursing homes and the aides who work in nursing homes, are they essential workers or not? We have a lot of internal decisions, but I think the rest of the world, I think Anita may have said this, or Marie-Ange, having a worldwide discussion of where the priority groups are, a worldwide discussion of what the protocol looks like, I think would be enormously helpful to get out of just a US-centric view, but health workers, vulnerable populations are likely to be at the front of the line. There's no way possible, Elizabeth, I don't think, to identify from the outside people with pre-existing conditions. That's really sort of self-identified, because it's sort of all ages and all stripes of folks. But I worry more about the groups of individuals and some people who would say, I'm just not going there, or I'm choosing not to participate, which still leaves a whole lot of people at risk.
So Kathleen, I want to unpack what you said for a minute. What would be nuts about having a state-by-state rule? What would be chaotic? Like, specifically, what do you think might happen if this is done state by state?
Well, it's just the states certainly will be responsible for location, where to get vaccinated, recruiting, the vaccine providers, how to, what the logistics look like. That is a very appropriate. But in terms of, North Dakota having a whole different group of individuals who are prioritized as opposed to Texas, and then trying to figure out the logistics of that. Right now, this is another area that our federal government, for the first time in a national health emergency, has pushed off what should be, I think, a national plan to a state and local level. And what we've seen so far is that hasn't worked very well. Not having a national strategy on everything from communication to, health protections has not really been very effective. So I'm hoping when we get to vaccine that we would have a national framework with a clear national identification of priority. We know that the vaccine won't arrive all at the same time. We know that you won't have all the doses ready at once. So where they go, how they get there, who gets in line, I think needs to have some sort of transparency and some sort of national framework, and then can be delivered and administered at the local and regional level. But without that national strategy, I am very worried it could look like the PPE, where every state's fighting with every other state, and they're fighting with the federal government, and they don't, some have a supply chain of their own. You've got governors flying private plane, and all due respect to the private sector and the role they can play. You don't want to rely on the football team's plane to get PPE into a state. So, there's something that's a little crazy about this localized food fight on, and we've seen it on protective equipment. I'd hate to see it play out again on vaccine.
Gotcha. Well, we only have a few minutes left, but I want to finish up with looking into the future about distribution and supply chains. Are there things that we could be doing right now to enhance and buttress those networks and that supply chain so that this goes smoothly when we do have vaccines to distribute?
Definitely, Elizabeth. I think, some of the points that you raised earlier, actually, your previous question, about inequalities and so on. Actually, what we see best in immunization programs is when you have strong health systems. So now that we have talked about, we have seen all over the world, it's not, just in one country, really some of the stark weaknesses of health system is actually be ready to better prepare. So start preparing for the rollout of a vaccine that will be exceptional in history. And so prepare the health systems, indeed have a better network, have a better distribution, train the health workers. But of course, what we know also of these vaccines, and depending on the technology, is that we may have, for example, logistics needs that are quite different. And in a sense, there's a need to start preparing at a minimum for this logistic need, in particular cold chain. We have to remember that vaccines depend a lot on cold chain, and some of the technologies may require ultra cold chain or these type of things, but also as we said earlier, communication, preparing for the allocation framework, as Kathleen was saying, So I think, you know, a lot has to do with the health system and preparing the health system to be able to roll out the vaccine. And this we can start doing now.
I think on that
We
hopeful
don't have
note,
enough health workers, start hiring them, because we have seen that somehow in some places, you know, that's how, you know, some people have been more affected than others.
Magic word is preparing. Like we have to plan and prepare various scenarios depending on how many doses are going to be available, what the cold chain requirements are going to be. There's a couple of vaccines that may be front runner vaccines that have a -80 cold chain requirement. How do we do that around the world? Are we prepared for a situation where high income countries can do cold chain, but low income countries cannot, and so they're like 6 months later, which creates a huge inequitable situation. And so there's I mean, if we start preparing right now, we can do a lot to get ready in the next 3-4 months. But again, this is a pandemic, right? Everyone is affected. So we have to have a global coordinated response. We cannot have the situation of every country doing a different thing, every state doing a different thing. That is for sure not going to be an effective way to roll out the vaccine.
well, thank you. On that note, I think I will say thank you to all of the panelists. You have all been great and made so many wonderful, important points. And I feel like we should all get together in 3 months or so and do another one and see if some of the concerns we talked about, if those happened, and some of the challenges, we could look at those and see if they were met. But thank you so much. And I'm going to hand it back to Peggy.
Great. Thank you so much, Elizabeth and Kathleen and Marie-Angé and Mike and Anita. It is an all-star lineup of people who've devoted your lives to tackling these issues. This has been a fascinating conversation. A few takeaways from me. Anita, your statement, without a global approach, we're not going to beat this pandemic. Mike, you said it's all about trust. And then you asked us to consider the critical role of the private sector. Kathleen, your clear call for a national framework and a strategy for vaccine distribution. And Marie-Angé, you're saying that the strength or weakness of health systems will make or break whether we're able to distribute vaccines. So I thank you all, and to all of our listeners, both on C-SPAN and elsewhere today. Thank you for tuning in. And I think we already have a request to do the reboot, the serial number 2, which I hope we'll be able to do again. So thank you all for joining us today.
Thank you.
Thank you.
Thank you.
Good to see you all.
Thank you. Thank
Good
you so
luck.
much. Thank you. Thank you, Elizabeth. Thank you,
Be
Peggy.
safe.
Thank you. Stay safe. You bet.
Bye.
Bye.